may have noticed recently that more and more people may be suffering from a runny nose and itch or watery eyes. But could it be allergies or the start of a cold? This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Jennifer Boothia, an allergist at the Queens Medical Center. Aloha and good morning, Dr. Boothia. Thank you so much for stopping by.
Good morning. Thank you for having me.
So yes, we've been getting reports of people who are suffering from allergies. Can you explain some of the things that might trigger these allergies?
Absolutely. So what a lot of people are worried about right now are seasonal allergies. The things that trigger seasonal allergies are pollens, specifically pollens to trees, grasses, and weeds. And they are airborne pollens. So although we have beautiful flowers here in Hawaii, they're not pollinated by the air, so people aren't responding to flower pollen. They're going to be responding to the trees and the grass and the weed pollen. And those things pollinate in a seasonal pattern. Then there's also environmental mold spores, also carried by wind, but we live in a tropical climate. So rainy tropical climates tend to have higher mold spore counts. So that's another contributing factor to people who have environmental allergies.
Interesting, okay. We hear some people say, hey, I have a runny nose, it's just allergies. They can cross over with some cold symptoms. How do you know if it's allergies or something that might be a cold virus?
So it's an excellent question because there is a lot of overlap between a mild cold and allergic rhinitis. So the sneezing, itchy, watery nose, congestion. So some things that are really important in the context are whether or not you have a history of a pattern of having this. If there's been a new exposure in the home, like did you just get a new cat or a new dog? And then also if the symptoms are increasing in severity over a few days. And if anybody has symptoms like fever, body aches, or any kind of difficulty breathing because the cough is so severe, then those people really should be seen by a clinician just to make sure that they don't require any prescription medication or additional studies.
Or if you have young kids like me, it's mostly always going to be a cold because they're always getting sick. And lastly, for those of us that do have allergies, what are some of the treatment options to help get this under control?
So as an allergist, I oftentimes will joke with people and I say, most of what I prescribe is available over the counter. And that is true. So right now, I recommend people consider over-the-counter, long-acting, non-sedating antihistamines. And those are great therapies. And when you take them every day during your allergy season, it is very effective in blocking that histamine response. Other medications that can help are things like nasal steroids, and also there are allergy eye drops, which can also be very, very effective. Some patients, though, their environmental allergies are fairly significant. The symptoms are severe. They may also have allergic asthma, and those are patients who really should be referred to an allergist for more specific testing, and they may be candidates for something called allergy immunotherapy, more commonly known as allergy shots. So that is a treatment that is offered by allergists, and what it does over several years is it actually desensitizes you to what you're allergic to. So it is considered a more long-term treatment.
And to learn more about the services offered by Queens Allergy and Immunology Clinic, you can call 808-691-4970. Thank you so much for joining us and for all the information today, Dr. Boothia.
Well, thank you. You're welcome.
Have a great day.